Today's family caregiving webinar. My name is Carrie McClellan. I'm the outreach manager for ElderHelp, and I will be the presenter for today's topic, Aging in Place, Support for You and Your Loved One. So a little bit about how the webinar works. You're automatically muted. You don't have to worry about your cameras. But if you do have any questions, you are welcome to type them in by using the raising of your hand feature or the questions, and that will alert me. I will most likely go through the presentation, and then at the end, I'll go through the questions that might have come in during that time. So if you have anything pressing, don't wait until the end. You can feel free to type that in, but then we'll review everything once we're done. So hopefully that helps just to streamline things. A little bit about me. I have been the outreach manager for ElderHelp for almost 11 years now. My role is to do our community outreach to let people know about the services that we provide. I'm also the first point of contact for any prospective volunteer who might want to join our organization, and volunteers are definitely at the core of ElderHelp. And I oversee our family caregiver support, which is where these webinars are facilitated through. So we often work with different organizations and presenters on different topics, but today we're going to focus on aging in place, and so I thought I would take that topic because this is one that is near and dear to our heart at ElderHelp and mine personally as well. Prior to ElderHelp, I worked in a long-term care skilled nursing facility as a social services director. So one of my main roles was discharge planning. So I worked with individuals and families who were coming in perhaps after an injury or a fall, some type of healthcare need that required hospitalization, and then a short stay in the nursing facility, or perhaps they were looking for a longer term situation. But my role was to help figure out what the discharge plan might be if it was to go home or to a different level of care, and help make those plans as safe as possible so that that individual didn't end up back in the hospital. So that's just a little bit about me and what my role is and my experience. And we will go ahead and get started. I will share just briefly about ElderHelp and our mission. I mentioned the aging in place topic is near and dear to our hearts at ElderHelp, and that's really our mission. We want to support older adults and their desire to continue living in their own home for as long as possible. We want to make sure that that's done safely and that they have dignity along the way. So that's really what we strive to do through our programs. We have been supporting the San Diego community for over 48 years now. So we provide direct services to older adults, but we also have a variety of supportive services that we offer to family members who might be caring for an aging loved one, whether they live in town or out of the area. The services that we provide through ElderHelp, we have our information and referral. This is something that is available to anybody. We get calls from all over San Diego County and beyond, different states as well. But that's really an opportunity for us to help connect people to resources so that individuals are familiar with what might be available, whether they're looking for options for themselves or for a loved one. So that's a service that we provide over the phone. We offer Are You Okay calls. That is how we can check in with individuals who may not have anybody else checking in with them on a regular basis. So we're able to call them at the same time every day, Monday through Friday, to just do that safety net check, make sure that they're doing all right, and that allows them to have peace of mind. They do have family members involved. That also gives a family member peace of mind knowing that somebody's going to call, and if there were an issue, we would follow up with that emergency contact as well. Our family caregiver support, I will go into much more detail about that in a little bit. So that's just where these webinars come into play. Our Seniors a Go-Go program is our transportation. So volunteers are providing rides to medical related appointments for seniors in the community. Our care coordination program combines our social workers. Those are our care coordinators. They provide advocacy and connection to resources. And then our volunteers provide additional support in the home and outside of the home, so that our clients are able to continue living in their own homes for as long as possible. So that provides good social support as well as different tasks that might need to happen. Our housing services team helps with a lot of affordable housing needs of the community. So individuals who might be looking for different options. We also have a shared housing program called Home Share, and I will talk about that in a little bit as well. So more information to come. And today's topic, so when we talk about aging in place, I will also talk about how best to plan ahead, kind of assessing your loved one's needs now, but as we go through time, or a few months from now, a couple of years from now, things are going to change. So just knowing how to continue assessing those needs of your loved one, but also of yourself too. So we'll talk about starting the conversation, knowing the options. That's a huge part. A lot of times people contact us and they have no idea where to start. They aren't familiar with what resources are available. And if you do live in the San Diego area, we are very fortunate because there are quite a few community resources that are available, but it's just a matter of knowing how they work and how to access them. And if you are joining us from outside of San Diego, I'll also provide some resources for you to access in your particular area you can find as well. So we'll go through all of that. But let's start the topic by talking about aging in place. So why is this important? Well, because there is a study that was done through AARP that the results showed 90% of seniors want to age in place. And that probably doesn't come as a surprise to anybody if I were to ask all of you if you wanted to age in place, if you wanted to continue living in your own home, or if you plan to move out at some point and move to assisted living. I could probably guarantee that majority of us would want to stay in our own home. We want to continue to live where we're familiar, in our familiar environment and surroundings. So that's, it could be where we've lived for 30, 40 years. Maybe the home is part of it, but it also is the community aspect. I know the people who work at my grocery store and at my bank, and all of those different aspects are really important as well. So when we talk about aging in place, and we know that 90% of people want to age in place, we also know that about 70% of those individuals who do want to age in place will need some type of additional support along the way. So whether that is through a volunteer organization, whether it's through a family member supporting them, or through other forms of support, like home care agencies, for instance, or other organizations that provide resources. So whatever it might be, there will need some type of support in order to maintain that independence and in order to live successfully at home. So this topic is important. It's also really important to understand where your loved one wants to live. In my time, I have met a lot of people along the way, and I always ask, where do you want to live? Is it something that you are planning to continue aging in place in your own home, or have you looked at other options? And I have met one person in my almost 15 years of being in this industry who has said that they wanted to move into an assisted living at a certain point, and they were okay with that. They already had it picked out, and that was their plan. That's one person. So the majority of people do want to stay at home, but I also applaud that person for having a decision made and for looking at the options ahead of time so that they are part of that conversation with their family and they know where it is that they would move to should they not be able to stay in their home anymore. So it's important to understand the why. When you are having a conversation with your loved one about this, finding out why they want to stay at home can make a huge difference. If they have a pet that they don't want to leave behind and they're concerned about other options, and if they would be able to take that dog or cat along with them. That's an important part to consider as well. So when you are looking at, at some point, if your loved one isn't able to continue living at home, are they able to bring their pet along with them to the destination that you're looking at? Do they like to garden? Is it important for them to have a place where they can get their hands dirty and plant different herbs or different vegetables or flowers? Does that make them happy? And maybe it's not going to be a huge yard that they need, but maybe they do want to have some potted plants on their balcony, for instance. So kind of looking at those different reasons and understanding the why can help you plan for the future. Cost can definitely be a concern and a factor, and we'll talk about that in a little bit as well. And of course, nobody wants to lose their independence. Nobody wants to be told that they are no longer able to stay at home, that they need to find another option or they need more care. So having that conversation with somebody so that you can have that decision made collectively is going to be key. We really want to make sure that our wishes are being met, and that's important for anybody. So telling a loved one that it's time to do X, Y, or Z is probably not going to be super successful. So you would want to have that conversation and again understand why they are having the decisions made that they are, and be able to know what to do for the future. So starting that conversation early can really help so that you can have those conversations together. And then planning ahead and knowing the options. So we'll go through each aspect of this so that we can talk about the different options that might be available. So when we look at assessing the needs of our loved one, it's really important to look at a lot of different aspects and know that those needs are going to change over time. So you're kind of getting a snapshot, a current assessment of what's going on now. You're maybe understanding what the history has been about, but you're not going to know what the future is going to hold unless you can plan ahead, unless there are some diagnoses or conditions that we know are progressive and you can plan accordingly. So when we look at assessing needs, there's two different buckets, if you will. There's instrumental activities of daily living. That's often referred to as IADLs. So that would include things like driving, getting to the grocery store, getting to doctor's appointments, doing the shopping. So how is somebody able to write out the list? Are they still able to follow that list and go through the grocery store and carry the items back to their home? Do they need an advocate? Is it time for them to have somebody who can support them and make sure that their wishes are being met? So looking at all of those different IADLs and how somebody is living at home and doing so. If it's that they are able to handle most of the laundry, but they're not able to carry the laundry basket up the stairs, then you're looking at those different perspectives and those specific needs that your loved one might have. So it might not be that they need help with everything, but there might be certain aspects that you're wanting to bring in additional support to help with. Activities of daily living. So those are things that we need to do to survive. So we need to be able to eat. We need to have good hygiene. So whether that's having good bathing help, grooming, and then transferring. If somebody is not able to safely get in and out of a chair on their own or get out of their bed on their own, then that's when they would need additional support to be able to help them with those things. So the IADLs are kind of those planning things and going out of the home. The ADLs tend to be things that are our basic needs that we need to be able to do to survive. So looking at those with your loved one, and again, assessing where they are now, and also assessing preferences. So when you are looking at care needs and looking to what resources might be available, it's really helpful to have an understanding of what your loved one's preferences are. If you are looking for help with bathing, for instance, do they prefer to bathe in the morning or in the evening? Would they prefer to have a male or a female assisting them? So understanding all of those different particular needs can be really helpful so that it can be a more successful plan. So when we talk about creating your support network, so this is kind of putting all of those pieces together to figure out who is going to help. So if you are just planning ahead and looking at how your aging loved one is going to need assistance in the future, maybe they do okay right now. They're pretty independent. They're able to get to the grocery store. They have a friend who takes them to their church services or other activities. But at some point they might need additional support. So you're kind of looking at that network to see who's currently helping, where those gaps are, and for the future, where you might be able to pull in some other support and other resources to be able to fill that in so that your loved one can continue to stay safely and age in place at home. So when we think about what type of caregiver are you the one who is living next door and you're able to go at a moment's notice? Or do you live out of the area of your loved one? And so you're the person who your sibling may call in a time of distress and say, I don't know what to do. Can you help me figure this out? And so you're kind of being that sounding board, perhaps doing the research or looking for different resources from afar because you're not in the day-to-day, you're able to kind of be that person. So looking at where those gaps are and filling in with different people in your team and in your network. It might be that you have somebody in your family who's really good at the financial side of things, understands the insurance, understands how to plan for that. And so maybe they would help with those different aspects and be able to bring that part together. My in-laws live out of the area, but because I have been in this type of work and industry for quite some time, if they go to the hospital or if they go to a skilled nursing facility for rehab before going back home, I'm often the one that might call and speak with the case manager or speak with the nurse to understand what's going on so that I can relay that to the rest of the family members. I might not live in the area, but because I have that knowledge and expertise, I'm able to play that role. Whereas my brother-in-law is there and is able to visit and can go look at different options and can be kind of the eyes and ears right there. But we can together work on filling in those gaps and making sure that everybody can have a part in that process. So it's helpful just understand. And it might be neighbors that are involved too, and maybe they have a system, we hear sometimes where across the street neighbors will keep an eye out to see if somebody doesn't open their curtains that day. That's kind of a red flag, and they would go and check out what's going on. So building in all of those different individuals and making sure that you have that support network and know that it will change over time. So kind of figuring out who might be able to be part of that team as time goes on. So those are all different things to consider as we go through the resources and how things work. I just wanted to kind of set that stage for having those considerations as we go throughout today's presentation. So let's talk about community support. So when we look at the different knowing the options, community support is definitely something that should be involved because there are so many different resources that are available. But again, it's just a matter of knowing about them and figuring out at what point is best to bring them into that network and into that puzzle. So I'm going to start with transportation because transportation is one of the highest needs of seniors that we find. They're calling often to find a way to get to the grocery store or to get to their doctor's appointments or to get to their church service. All of those different things are really important. I met somebody when I did a presentation one time who said, I think I need to move into an assisted living facility because I am no longer able to drive on my own. I'm not able to get anywhere that I need to go. And I was able to provide resources to that person so that they could stay at home. They could continue to live where they want to and access transportation and rides to get to the different places. But that doesn't mean that you have to automatically move if you're not able to to drive on your own. There are so many wonderful resources that are available. So one I wanted to share with you, if you're not familiar, there is an organization that's called FACT, and that stands for Facilitating Access to Coordinated Transportation. So this is in San Diego. It covers the whole county, and this organization coordinates different transportation options. So they're familiar with all of the different options that might exist all over the county. They're really helpful because they know the different levels of transportation. If somebody needs wheelchair transportation, they can have those options. If somebody is looking for volunteer driving opportunities, they have those options as well. And they would be able to provide those different resources to you. They have a wonderful website that lists all of the options, or there's the phone number here, and I will share this afterwards as well so that you have it. But it's a really good option for looking at what might be available. Of course, there is Uber and Lyft. Those are different transportation options that are available. More and more older adults are starting to utilize them, but often it does require having a smartphone or that way to schedule their ride. So it isn't for everybody, but those can be another option as well. I mentioned the volunteer driving program. So on FACT's website, you're able to search for the different volunteer driving programs that might be available in your loved one's area. There are several that might have overlapping service areas, but you're able to see the zip codes and you can contact those agencies that might be in your loved one's area to find out how they work. Nutrition is another topic. So making sure that our loved ones are getting adequate nutrition is really important. When we talked about the ADLs, that is one of those basic needs that we need to be able to survive. We need to be able to eat. So whether it's having somebody prepare meals for them, or whether it's having a service deliver meals, there's so many different options that are available. I've only highlighted two, but there are so many others that are available in our county and beyond. So if you are looking for something specific, you're going to find different options and probably more options than you know what to do with. But here I've included Jewish Family Service. That is a great organization. It's a nonprofit organization that does support people of all ages, but they have a variety of programs specifically for older adults. They do offer home delivered meals, transportation, as well as other resources. So if you're not yet familiar with Jewish Family Service, I definitely encourage you to check out their website. You do not have to be Jewish in order to access their services. Meals on Wheels is another option. They are a great organization that covers every area of the county and beyond. There's a national Meals on Wheels organization as well. The one in San Diego has different branches depending on the particular region. So if you're interested in finding out about how their meal programs work, you can visit their website, and I have it included here, mealsonwheels.org. They offer a variety of options too. So if you're looking for frozen meals, if you're looking for just a couple of meals each week or daily, you can have those different options. ElderHelp also has a pantry that we started during the pandemic that we're delivering food and essentials through as well. And then when I always think about resources, and this organization comes to mind quite often, because if you're not familiar, every county has an area agency on aging. That's a mouthful, but it's essentially the AAA for each county. So the area agency on aging, and in San Diego, our area agency on aging is called Aging and Independence Services. So that is the organization that helps to provide support and resources for people who are considered an older adult or adults with disabilities. and they have a variety of programs and services available, but they also connect you to different resources. So if you're not yet familiar with Aging and Independent Services, also known as AIS, I encourage you to check out their website, or you can give their phone number a call, and that would go to the call center. This is the agency that you would call if you have any concerns about an older adult and needed to make a report to Adult Protective Services. That would be the phone number that you would call. They also offer a variety of case management programs. They can connect to different meal services, and they also offer in-home supportive services that I'll mention in a little bit. If you live outside of San Diego and are wondering who your area agency on aging might be, you can go to the website that I have here, or if you Google Elder Care Locator, you would be able to search by zip code to find out who your local agency might be. Or if you're caring for a loved one that lives out of the San Diego County, that could also be a help to you there. If you are looking for resources specifically in the North County area of San Diego, I just wanted to mention Interfaith Community Services. They are another local nonprofit organization that offers a variety of programs and support for older adults in the North County area. So if you're looking for that specifically, I encourage you to check out their website. All right, so when we are looking at our loved one's ability to continue aging in place, home safety is a factor, and more specifically, fall prevention. So there are different resources that I will mention, but first I want to talk about fall prevention for a minute. So a couple of stats to be familiar with. So 1 in 4 adults over the age of 65 falls each year. So that's definitely quite a few people. We know that 60% of falls occur in the home, and most falls are preventable. So what's important to think about when you're looking at your loved one and if they're able to continue living in their home, looking at the safety aspects. You know, do they have any tripping hazards? Do they have are they able to maneuver through their home safely? Are they able to bathe and do all of the things that they need to do part of their ADLs safely on their own? Or do they need to have a grab bar installed in their bathroom for extra support? Do they need a railing to be installed to go up and down the stairs safely? So looking at all of those different aspects are really important so that you can make sure that your loved one's home is as safe as it possibly can be for them to continue living in it longer. When we look at how to prevent falls, home safety is one of those aspects, but it's also important to consider making sure that all the other aspects that are on this slide are included. Having that physical activity. So you've probably heard the phrase, if you don't use it, you'll lose it. And that is definitely something that we hear quite a bit. The more that people are not getting up and doing the activities that they used to, the pandemic has definitely had a factor in that for people of all ages, but of course for older adults who are at a higher risk for falls already, that's something that we want to focus on. So making sure that we are looking at the different ways that our loved ones can continue to stay active and exercise and do so safely. Having medications checked by a physician or by a pharmacist is really helpful. A lot of times people are taking medications for many years and the dosage doesn't change unless you have it reassessed. And as we age, our bodies change. So there might need to be some modifications that are made over time. So having that reassessed on a regular basis by a physician or by a pharmacist is really helpful to also make sure that there aren't any complications with 2 medications that are being taken at the same time, or any potential side effects that might come from a new medication. So having that reassessed is really helpful. Also looking at vision, making sure that our loved ones are having their vision checked on an annual basis is really helpful. Vision changes, our eyes are changing. We often need more light as we are aging, so looking at the home again to make sure that in those areas that our loved one spends the most time, that there's adequate lighting. If they get up in the night to go to the restroom, are there lights that are available along the way? There's really great censored lights that can be put in so that when your loved one gets up, if they don't want to have a big overhead light on, you can have those censored lights. So as they walk, it lights up their way, and so they can make sure that they get there more safely. Talking to the healthcare provider about any changes or any concerns is really important, especially if somebody has a new diagnosis or is taking new medications or is having any changes with their vision or physical abilities. Any of those things can be helpful to have that conversation with a healthcare provider on a regular basis so that you can make sure that you're notifying them of any changes and they're able to then better provide you that support that's needed. Chronic conditions. So we're able to live a lot better with chronic conditions now if they are managed well. So again, making sure that we are looking at if we have a diagnosis that is something that is going to progress or our loved one does, knowing how it will progress and knowing what those next phases might be can be really helpful to plan ahead when you are looking at the safety of somebody living at home or if additional care needs might need to come into play. So there is a San Diego Fall Prevention Task Force that focuses on all of these different areas. It's a group that meets on a regular basis. ElderHelp is involved as well, so we participate. But if you're interested in checking out what resources they have available on the website, if you go to sandiegofallprevention.org, you can have access to a variety of resources for San Diego and also connect to others that are available in other areas as well. So that's a really good resource to consider. And then a couple of other options for your loved one if you are looking at, how they are able to continue to maintain independence and what if they need extra help with managing their medications or you're worried about them living at home alone. What if they do have a fall? How will I know? So there are different devices and different options that are available. There's medication reminders that can be set. Some people have the medication dispensers that you can put all of the different pills into, and at a certain time every day it might alert the person and they would be able to take those medications, and then you know that they're taking the appropriate amount and on time. There's also different ways to do that through home care agencies and other electronics, like if you were to use Alexa or something along those lines too, that can be helpful for people to have those reminders. If you are concerned about somebody falling, your loved one is a fall risk, perhaps they live at home alone, you're not sure what might happen if they do have a fall. One option that can be really helpful is having a personal response system. There are several options that are available. It's that button that you can have them wear around their neck or around their wrist. And if they were to fall, and some of the options might pick up on it. If they were to have a fall, they might call and say, what's going on? Are you okay? And they can communicate through that. Or if the person pushes the button, that would go to a directory and they would be able to help get them the assistance that is needed. So those are really helpful. And then when we look at, planning ahead and having the conversation and making sure that we're including our loved one, kind of going back to that, it is important to make sure that that we are including them in any of the conversations and understanding what their wishes are. Some important documents that you might have in place or you might be interested in having in place, maybe they're not yet, An advanced healthcare directive would be a really good place to start so that you can have your loved one designate who they would want to be as their person if they were not able to make those decisions on their own anymore. So identifying who might be in their life that could be a good fit for that, and putting that on paper so that everyone knows, everyone has those expectations. And if your loved one does already have that in place, making sure that everybody has copies of it is really helpful. There's also what's called a vial of life. If you aren't familiar with that, I'll give you kind of the 30-second version of it. But a vial of life is where you can have a piece of paper that includes all of the emergency contact information, perhaps diagnoses of your loved one, medications that they're currently taking. All of that information can be kept in a vial, kind of a plastic sleeve on their refrigerator. So if they were to call 911, the paramedics would know to go to the refrigerator to look for this vial of life. And if they, your loved one isn't able to communicate all of the different information that's there, they would have that in front of them and be able to have access to all of that helpful details, medical information, as well as emergency contacts. So that's something that is really helpful. The Aging and Independent Services that I mentioned before has those available that they offer, but you can also just simply Google something, or you can write it on your own paper and write vial of life if you wish. But that's a really good way to make sure that all of the information is in one place should any emergency happen. What a good tip for that too is to make sure that it's updated. All right, so what happens when more care is needed? So what if your loved one is looking for additional support, or you're feeling like they could benefit from additional care? So we're going to talk about home health and in-home care and the differences, because a lot of times people get confused with which one provides what type of service and how you can access them. So home health care is more of the medical side. That's typically a short-term option for people who have maybe come home from the hospital or who are being discharged from a skilled nursing facility if they were there for a short-term rehab and are going back home. A home health agency might be referred by the physician so that they have some continued follow-up. So that could include things like nursing care. Maybe they're needing additional IV antibiotics or wound care, and so that might be the home health nurse that would provide that support. Physical therapy can also be an option, occupational therapy, speech therapy. There could be a social worker that's involved, a home health aide to help with bathing. And a lot of these services are not going to be for a long period of time. Again, they're going to be more of a short term, but it might also be to help train a family member at home how to do some of these things so that they can continue to provide that after the home health order is finished. So it's most often paid for by health insurance. So Medicare would be something that would cover it, or other health insurances. If they provide authorization for it, it might be something that is offered, but it does typically require a physician order. So that's kind of that short-term need, just to make sure that those individuals who are discharging home from the hospital or from a rehab facility have that continuum of care. In-home care, on the other side, is more non-medical caregiving services. So this could be short-term or it could be long-term, but it's really more of helping with those ADLs that we talked about. So meal preparation, it could be housekeeping, bathing or toileting needs, medication reminders, or even just companionship or safety, having somebody there when a family member isn't able to be there, if somebody needs more around-the-clock care. So let's talk about who pays for home care. So home care is something that is typically paid for out of pocket, which means it's private pay. The costs are just increasing all the time. The current rate is about $30 to $37 per hour for this type of service. So there are other options that might help to pay for this cost. Medi-Cal is one option if somebody does qualify. They could potentially access the in-home supportive services program that is through the County of San Diego I mentioned earlier. To determine eligibility, an individual would need to call Aging and Independent Services to find out how to start the process. But it does have to be somebody who has Medi-Cal. So if they don't yet have Medi-Cal but maybe qualify, they could start that process as well. And in-home supportive services could be an option. Through that program, a family member who is providing care for a loved one could then be paid to provide care to their loved one. So that's one option. Another option is if there isn't an individual who is already able to provide that care, then the in-home supportive services program could provide a list of potential caregivers that would be through the program and be available to do so. So that's one option. If your loved one is a veteran or a spouse of a veteran, they may qualify for a program through the VA that's called Aid in Attendance, and they could have additional income to be able to pay for home care services or for assisted living if they were to move out of the home. So that's another option. I encourage anybody to check out the va.gov, learn more about Aid in Attendance to see if that might be a qualification. Long-term care insurance is another way that home care can be paid for. Perhaps a portion of it, it might not be the entire amount, but for people who have been paying into a long-term care insurance policy and maybe aren't sure what options are available or how the policy works, we would recommend contacting HICAP, which is Health Insurance Counseling and Advocacy Program, to get assistance with understanding the policy. So that's a free resource for people in San Diego who would be able to find out what their policy might cover and learn more about how they could access home care services that way. So how to hire a caregiver. If you are looking to hire a caregiver through an agency, there's kind of two different ways. One is through a licensed home care agency, and another is hiring a caregiver on your own. So if you are looking for an agency that has caregivers on staff, that would be through the California Department of Social Services, and it would need to be a licensed home care agency. So there was a new law that was passed in California a few years back, and so now all agencies do need to be licensed by the state of California. So that's something to keep in mind. To find out if a home care agency is licensed is a little bit tricky. They should have a license number, but if you're just wanting to search and look up a specific agency to see if they are licensed, I will send out the details on how to do that after the webinar so that you have it. But essentially, you're going to go to the California Department of Social Services website. You're going to go to Find Licensed Care and scroll down to search for a facility, which sounds different because you're looking for care at home, but that's the way that they have it set up. And then you would select the option for home care organization and enter the organization name. So hopefully that helps you kind of figure that out. But being licensed means that that agency is going to have all of the background checks completed. They're going to have workers' compensation. They're going to cover all of the taxes and all of the benefits for those caregivers. So it is helpful to go through an agency. If you choose to hire somebody on your own, it's important to note that you become the employer and you're then responsible for filing taxes and having workers' comp and any of the unemployment laws that come into play. You also want to make sure that you are prepared with a backup plan if you do hire a caregiver on your own. If that caregiver is sick or is no longer able to come, you would want to have somebody in place to be able to fill in. Whereas if you go through an agency, they're responsible for finding that backup plan. So those are just different options to consider. And real briefly, I wanted to mention a program that is available in almost all areas of San Diego County. It's called PACE. It's the Program of All-Inclusive Care for the Elderly. And PACE is a really great program for people who are 55 and over who want to stay in their own home, but are maybe qualifying for nursing level home care. So maybe they're needing medication management. They could benefit from some physical therapy or from a home care situation. They could also benefit from having socialization. So if the PACE program is an option, they would have to go through an eligibility process for that. And there's 3 different options that I've listed here that are available in our county. So St. Paul's PACE, San Diego PACE, and Gary and Mary West PACE. They all operate similarly, but they're in different areas. So if you're looking for a particular area, that would be why you would go to a different agency. But that's another option. It is typically for somebody who has Medicare and Medi-Cal, although if they don't have both, we call them dual eligible, then there might be a possibility they could still access the services and just pay a share of cost to do so. So another option is if your loved one has a spare room in their home and perhaps they would like to share their home with another individual. It could be that they do so to just have the additional income to be able to pay for services that they might need assistance with, or it could be to have peace of mind knowing that somebody is there overnight in case I were to have an emergency or a fall, or it could be that the person is helping with meal preparation or transportation services or light housekeeping. So there's a lot of great benefits to doing a shared housing situation. ElderHelp has a home share program that facilitates matches by matching a home provider, an individual who does have a spare room in their home, with a home seeker, somebody who's looking for a room to move into. And again, it could be rental exchange or it could be service exchange or a combination of the two. Our program is currently more focused in the areas of Poway, the city of San Diego, and Vista. Although if there are home providers who live outside of those areas, we will try to help them find somebody who could move in as long as we have that availability. There are other options as well. Silver Nest is another option, or if you live out of the area or might be looking for other programs, you could go to the nationalsharedhousing.org website to find all of the different shared housing programs in the nation. That's another good resource there. And then when it's time to consider other options. So of course, you know, living at home or having your loved one continue to do so. These are just some helpful questions to figure out. When is it time that they're no longer able to safely live at home? Are you having concerns about them cooking? Are they not able to get up and down the stairs anymore, and you're worried about them having a fall? Is the care getting too costly at home? Hiring a home care agency without the extra assistance of the VA or other benefits could add up quickly. And again, going back to the original question, what does your loved one think? Having that conversation throughout the years is really helpful. So starting it now, understanding where they're at, but also having an idea about, you know, if you were not able to continue living in your home because of safety or because of cost, what is your next preferred option, so that you can have those lined up as available options should the time come. I just wanted to mention there are placement agencies that are available to help figure out what options might be available. So they can look for different options in a particular area based on cost, what amenities. So again, going back to my loved one wants to take their dog. They cannot leave their dog behind. I need to find a place that accepts pets. So those would be the types of things that a placement agency would need to know to be able to tailor a list of options for you and your loved one. You would want to find out how often they visit the facilities and understand what their reasons for referring those options might be, and also for you to go and tour a few of them to compare yourself. So getting all of that information is really helpful, but you would want to have a firsthand experience and maybe go take your loved one to lunch there one day so that you can have a feel for it. A really great resource that can also help you with comparing the options is Choose Well San Diego. If you go to choosewellsandiego.org, this would be the page that you would come to, and it really helps to kind of figure out what options might be available, whether you're looking for yourself or for your loved one, and also those different options that the placement agency might provide. You can then compare them in a different way. So it's just another resource to be able to do so. All right, so I know I've gone through a lot of information, a lot of resources and programs that are available, and I will follow up with this information so that you can have all of it as well. But I do want to close out with talking about support for you, the family caregiver, because whether you are a caregiver now, whether you're looking ahead for the future, whether you have been one or you'll need one, it's really important to understand what support is available as a family caregiver as well. We know that the process sometimes comes suddenly. You might not expect that your loved one is going to need a lot of care, and all of a sudden they do. There's a change, and now you're providing daily care. You're helping with bathing or meals. So there is kind of that shift. It hopefully can happen more slowly, but it doesn't always. Sometimes it happens more suddenly, which is why it's good to look at the plan and options and have that conversation with your loved one ahead of time. You want to make sure that you are continuing to take care of yourself. So I wanted to share about our family caregiver support that's offered through ElderHelp. I mentioned already our information and referral service. If you are overwhelmed and looking at resources and not sure where to start, you're welcome to give us a call and we can walk you through that process. Just a reminder that our Are You OK program is an option if you are concerned about your loved one, you want somebody else to just check in with them at the same time every day. That's something that we can do as well. These webinars, I'll talk about what's coming up in the ahead, but I did also want to mention that ElderHelp has created online courses. These are the 5 different courses that we have created. They're all available at no cost. You can access them through our family caregiver page of our website or by going directly to elderhelp.thinkific.com. And a lot of the course information will help you with assessing your loved one's needs. We have really great tips and tools. So if you're looking for more guidance in how to assess that and how to plan for the future, how to put together your support network, I definitely encourage you to check out these courses. They're self-paced. You can access any of them at any time, and that would help provide you with that support to be able to assess now and plan for the future. There's also a course on self-care, so looking at what other caregivers can provide as tips, one specifically on when your loved one has dementia, and for working family caregivers. So if you are working and looking at different options and trying to navigate that process, that could be a good course for you to check out. So I am excited about our upcoming webinars. We started with today's Aging in Place so that you can have an understanding of what resources might be available to help your loved one continue living at home. But next month's webinar is going to be looking at the prospect of downsizing, when it might be time to do so, and what the options might be available for doing that successfully. So again, working with your loved one in the process, not against them, helping to declutter if it's just doing that in the home that they're in now, but also what to do if you are looking at selling your loved one's home and how to make that decision. So we'll be talking about that. And then in April, we will have a webinar that will be on elder fraud and scam prevention. So I definitely encourage you to keep an eye out for more information about these. And the one in June will be on dementia care options. So it will be talking about care options at home, or if your loved one is starting to progress in their dementia and perhaps needing to look at alternative living options. So that one will be focused on both aspects, but all around providing care to a loved one living with dementia. So I encourage you to keep an eye out for more information. And as we wrap up, I always want to share our community partners who are also providing support to family caregivers in our San Diego County, Southern Caregiver Resource Center, and Alzheimer's San Diego. So I encourage you to check out both of these agencies if you haven't already. I encourage you to do so. They provide excellent support and education and resources for family caregivers in our county. So I encourage you to do so. I also wanted to mention the Caregiver Coalition of San Diego is a collaboration of nonprofit organizations as well as businesses and other companies who come together to offer free services for family caregivers. So there's virtual conferences and webinars and different resources that are available. ElderHelp is a part of this coalition as well, but I encourage you to check out the website so that you can have access to additional support and resources. And as I close out, I will open it up for questions. I know that was a lot of information, and I just encourage you to kind of take it one step at a time, but making sure that you are having conversations with your loved one throughout the process. So understanding what their preferences are, what their needs are, and why is going to make it more successful. Again, you know, we don't want anybody to make a decision about our lives and about us without including us in that conversation. So why would we want to do that for our loved ones? So thank you so much for joining today's webinar. I hope that you found it helpful, and I will be sharing additional information when I send the follow-up, but I appreciate your time today. And if you have any questions, you are welcome to submit them by typing them in. I'd be happy to answer them. Or you can feel free to reach out to me separately. You have my email address and ElderHelp's contact information on the screen. So thank you so much.